Welcome back, everyone, and welcome once again to one of our interviews for Lord Nelson's blog. I'm Ellen Rankins, and I'm a graduate student at Rutgers University with the Equine Science Center. And here with me today, I have Dr. Carrie Williams, who is also at Rutgers University, and she is our equine extension specialist, and she's going to talk with us a little bit today about equine metabolic syndrome. So Dr. Williams, I thought we'd get started, and I'd ask you to share a fun fact about yourself so our listeners can get to know you a little bit better.
That was probably the toughest question in the interview. I always try to think of something that people can relate to. So I guess I grew up in northern Wisconsin, and my mother always jokes that horse was my first word. However, I never grew up in a horsey family. I wasn't on a farm. My parents didn't own horses, but I loved them right from the start. Was riding when I was 6 with my mom, got my first horse at 12, got my first degree in equine science at 21, and I was a doctor of equine nutrition at 26. So, and it's funny, my dad watched me grow, and his only concern was that I find a way to make money at horses or whatever I want to do. So it was always my passion, but it was never theirs. So, they say it's in your blood. I don't know how I got it, but that's how I got it. So I guess that would be my little story.
Well, thank you for sharing. That's very cool. I like to hear that. And so now we'll dive into kind of our subject area for today. So our first question is just very broad. Can you kind of broadly define what is equine metabolic syndrome?
Yeah, and that's a great place to start. Metabolic syndrome in general can happen in any animal. It can even happen in humans. And typically it is described as having an increased glucose and insulin response with a standardized meal or just a standardized, test. However, in humans, they also can get hypertension. Now, horses don't necessarily get hypertension, but they can get things like laminitis and Cushing's disease, which are a part of the whole umbrella of equine metabolic syndrome. So there's not just really one thing. It's a whole host of things, and it could be anywhere as low as just a little insulin resistance to something as severe as laminitis
Okay.
can be.
And so you've alluded somewhat that it's a pretty broad range of things. So is there a standard diagnostic tool that is used in diagnosing EMS, or is it a little bit more complicated than that?
It's very complicated. I would say before I go into details, which I'll briefly go into some details, but it's so difficult to understand that anybody who might be concerned about their horse really needs to work with their veterinarian. Their veterinarian should know the proper test for what you're looking at with your horse, because if things like Cushing's is a concern, there is a blood test that they can do, and they send it to a particular lab that will give them, the positive or negative result of the Cushing and, the whole scheme of whether it's, mild case or more extreme case. Just to figure out if your horse is insulin resistant, which I mentioned is part of metabolic syndrome, can be a few different ways as well. Again, you can take one blood test, but that can be a little misleading because you need to know what the horse's diet is, when they were last fed, what they were last fed, how much sugars and starches are in some of their meals, because that's how you get the increase in insulin. So unless you know a lot of details that go into that one blood sample, it's really difficult. So typically what is done is there's a multiple series of blood samples that are taken. They usually fast the animal overnight, which means no food. And then they take a blood sample first, and then they give a meal or just a big bolus of glucose. So it's going to really shoot up the insulin level. And then they take another one, maybe even 2 blood samples about an hour to 2 hours after eating that meal or having that bolus of glucose. And they see how high insulin went. Horses that are insulin resistant are going to have very high levels of insulin. much higher than the normal. And there's a bunch of different numbers that I won't get into too much, but that will show you is your horse higher than normal, or extreme, or how high. And again, you work with your veterinarian to do a lot of this. The other test, which can test specifically for pituitary dysfunction, which also is related to Cushing's, is what's called the dexamethasone suppression test. And I know that's a fancy word. They measure a bunch of different things as well. So again, it's very complicated, but working with your veterinarian is probably the best idea.
Absolutely, yeah. I agree with you. Contacting the vet would be a great idea. And so so this is a very complicated syndrome with lots of different things going on, which can make it really hard for maybe the average horse owner to understand. So why should the horse owner be interested in learning more about equine metabolic syndrome?
Yeah, that's a great question too. Nowadays our horses are living much longer, and our horse population is getting much older. And that's when you usually start to see some of these complications occur is, 16, 18, 20, 25 years old. It depends on the horse. Just a little personal story. I bought my horse when she was a yearling. She turned 22 this year. We just had her tested for Cushing's and came up positive. So at 22 years old, things are just starting to happen. I know other people that, their horses by the time they're 30 are still fine, but it's more likely that there's problems at that age. The important thing for the horse owner is to catch it early, because if you let it go too long, more and more complications can occur. Like I mentioned, laminitis, and a lot of other problems that you don't even want to start with. How we caught it with my horse is she started having some injuries, some wounds that just didn't heal. She had a cut in her mouth that lasted about 2 months, which that's not normal. So when the vet saw it still there 2 months later when they were doing their teeth, she says that shouldn't still be there. We should probably get a test. So poor wound healing is actually the first sign. She also had a little bit of weight loss, and I took that to be, oh, they got poor hay. But now that we got her on the proper medications, things are looking up. Stuff is healing. She's gaining weight. So it's really important to catch it early before you have too many other complications.
Absolutely. And so I'm going to stray a little bit off track here, but so there's this wide range of things, and you've mentioned age as a possible risk factor for horses that maybe as they age, they might develop more of these things. Are there any other risk factors that owners should be aware of?
Yeah, we talk a lot about breed sometimes as well, and I guess in general, we can say some breeds are more disposed to things like equine metabolic syndrome. Some of the more metabolically efficient horses, I think we can say. Some of the draft crosses, halflingers, even some of the more easy keepers, some of the Morgans, Arabians, quarter horses, that sort of thing. So a lot of those horses are more predisposed to actually start it earlier in life. They might start to develop problems, mid-teens versus later 20s. Like I said, my horse was 20-plus-year-old thoroughbred, so it's not outside the realm for that breed. But to start some of these complications earlier, some of the breeds can be more predisposed to it. And then again, just obesity. You could have any breed and have an obese horse, and it's going to start to have some of these problems as well. So that's why good nutrition, good diet, and watching for obesity is a good idea as well.
Absolutely. So then that kind of takes us into the next question of if your horse does have a diagnosis of equine metabolic syndrome, what management strategies should the owner consider implementing?
Yeah, so really, again, once it's diagnosed by the veterinarian, talk to them to see what might be appropriate for your horse. If a change in nutrition is deemed necessary, they can even bring in a nutritionist like myself, or depending on their neck of the woods or you're across the country, you probably have access to an extension specialist that has some nutritional, qualifications as well. But the main thing really that the horse owner needs to do is to watch the horse's sugar and starch intake. You all might have also heard it called the non-structural carbohydrates, or NSC, because this is what creates that increase in insulin, increase in glucose, and therefore increase in insulin in the horses. So we really need to try to keep it as low as possible. So, for example, you have your barn hay. You have no idea what's in the barn hay, but there is sugars and starches in all hay. So a good idea might be to start soaking it. All you need is 30 minutes. Put it in a wheelbarrow or a muck tub and then feed it to the horses. And that leaches out about 30% of the sugars. So it can be pretty significant for some of these horses. If you're going to feed them a grain, look for one that says it's controlled starch or low starch. Especially if they're overweight, they might not even need a grain. So just go with a balancer pellet to balance out the minerals, but discontinue a lot of the grains. If they might need a grain, like some of these horses with insulin resistance or any of these other complications are exercising horses, so they need high energy. So it would be a good idea to go with a grain that might have a fat added to it. Some can be 6, 8, even 10% fat in the diet, and that'll help keep their energy up without needing so many of these non-structural carbohydrates. So it can be very tricky, but I think that's a good place to start, is just trying to get some of these sugars and starches out of the diet.
And can you talk any about, so you've mentioned hay and grains as possible sources of non-structural carbohydrates, but what about pasture? So for those horses that are out on pasture, how would you go about controlling starch and sugar intake?
That's a great question, and one I get an awful lot, because yeah, you're right. There are sugars and starches in the grasses, and it varies. It varies by day, it varies by season. So what can we do? Well, they can go out on pasture, if they're not the super severe cases like with laminitis. But really, the best way to do it is to make sure that you're not targeting these high sugar times. So, for example, in New Jersey, early spring, when the grasses are just starting to really take off and really grow, which is pretty much April in our area, really high sugar, high starch grasses during that time. So it might not be a good idea to do a whole lot of grazing during that time with these horses. Maybe wait until the grasses, mature a little bit more. Wait until end of May into June. Summer is the best time. The summertime pastures don't grow as quickly. Some of you might be saying, yeah, that's true, because when we have a drought, the grasses don't grow much at all. So that's a really pretty safe time to graze. Also early in the morning, because the way grasses grow is they save up all their carbohydrates during the day when it's really sunny, and they use them at night. So if your management is okay, so that you can get them turned out at 4 a.m., 6 a.m., whenever you can get out there, and then maybe bring them in by noon. Again, if it's summer, that's a really good time to do it anyway, because then the bugs and the heat get really bad. So that's the best time to have them outside. The other thing is really make sure that they're good quality pastures. And what I mean by that is not overgrazed. The grasses that are, itty bitty little overgrazed grasses are full of sugar. So they actually recommend that, you have some more lush, what everybody thinks are lush pastures, but they're more mature grasses. So they're not going to have as much of the sugars and starches. So make sure that they stay mowed at around 6 to 8 inches. Because also if they go to seed and they get all those beautiful seed heads, they're full of starch. So you kind of have to keep them in the middle of not being overgrazed, but not being too, too tall as well. So there is a lot of things they can do, and they can graze. It just takes a little bit more management to deal with that.
Absolutely. It's good to know. So I think that concludes the questions I had for you. Is there anything else that you wanted our listeners to know that you think I've missed today?
Well, the one other question along these lines that I get a lot is, isn't there a supplement that I can give my horse that'll help it out, that'll cure EMS, insulin resistance, Cushing's, whatever? And the truth is no. There's really been no scientific evidence that any supplements, I mean, I'm talking cinnamon, turmeric, any of these herbal products, high levels of, cobalt or chromium. I mean, there's so many out there that tout being good for insulin resistance, but, really there's been no scientific evidence on these. So, you're stuck with either a pharmaceutical product if you need to manage the Cushing's or any of those diseases, but otherwise, just keep them on a low sugar diet.
Okay. Well, thank you very much for sharing your time and knowledge with us today. It's very much appreciated.
You're welcome. Thanks for asking me.